Rabies by Carrie Butler, Nick Paul, and Clark Stoffer. The common strain of rabies is scientifically called Lyssavirus rabies. It is shaped like a bullet, but is covered in lots of tiny flagella, which makes it look a bit furry. It has a single-stranded negative sense RNA. Its primary reservoirs are wild animals such as canines, skunks, and raccoons. And it can be spread to dogs once they are bitten by a wild animal.
So some signs and symptoms for rabies. Some common signs include vomiting, easy agitation, fever, paralysis, coma, and convulsions. Some common symptoms that patients may report on are anxiety, nerve pain, itching, sensitivity to touch, headache, and fatigue. A really common sign is hydrophobia, and this is probably something that everyone was familiar with and thought of when you heard rabies, and this is the foaming at the mouth. So the virus is primarily transferred by biting, so it gathers in the mouth when preparing to infect a new victim. It doesn't want to get washed down into stomach acid, so it provokes a fear of water in the victim, which prevents them from being able to drink or swallow anything, which would then lead to the weakening of the virus's chance to spread. More on signs and symptoms. These symptoms and signs can develop within 3 to 12 weeks after the bite. It can show up quicker depending on the proximity of the bite to the brain. So the closer that a bite occurs to the brain, the faster that the symptoms may appear. It's usually only diagnosed after the symptoms have started showing, but by then it's too late. Death does normally occur within a week without the vaccination. According to Vincent Rossaniello, the fatality rate is at almost 100%, so death will almost inevitably occur. For transmission, how do humans get infected? Most commonly, it's through bites. However, it can be through bites, scratches, or inhalation of droplets from any of the domestic or wild animals that we previously mentioned. Infected humans are capable of spreading the disease through biting, but if the victim is advanced that far, then doctors know to take precautions to prevent this from happening and letting it spread. For prevention and control, any bites from wild or stray animals should be immediately assessed, whether you think they are rabid or not. Vaccinations can help prevent the spread of the disease, but once bitten, there's still very little chance of survival. The Milwaukee Protocol has been used to save very, very few people. It's only been a handful of people, maybe 5 or 6 ever. These people did not completely return to normal again. They had extensive hospital stays and were under intensive care, and they still suffered from repercussions even after they were able to leave. Overall, this treatment has been considered a failure by most people. There is still not any kind of protocol that has been made to help people still. For prevention and control, so what happens if you've been bitten by a wild animal? All wild animals, especially skunks, raccoons, foxes, and coyotes, are presumed to be rabid, and treatment will start immediately. The bite wound is infused with human rabies immune globulin, HRIG, so this helps slow down the spread of the virus. And then synchronously, a full course of vaccination is started. The current choice vaccine is the human diploid cell vaccine, the HDCV, and these are injected intramuscularly or intradermally. And back to the wild animals, the reason that the treatment starts immediately is because the only way to really know if an animal is rabid is to assess the animal that bit the person, and especially if it was one of the listed animals, that's going to be extremely difficult to do. So they just take the precautions and start the treatment immediately for everyone.
So with the history and background of rabies, some of the key players in the history of rabies, their names are pretty difficult, so I apologize if I butcher their names. But with some of the earliest dates I could find, dates clear back to 1548. There's this guy named Girolamo Fracastoro. He theorized that rabies was being transmitted via saliva or a substance within the saliva. Turns out he was correct, right? In 1804, George Zink, he injected rabies into animals, proving it to be infectious. And then Louis Pasteur, who's obviously very famous, and Emily Rowe, they showed that rabies is found in the brain and spinal cord. And in 1885, they developed the first vaccine. So the story was that there was a boy bitten by a dog, and then Louis Pasteur gave him 13 injections containing a weakened rabies virus, and it cured his problem. So the virus, once that vaccine was discovered, it was initially cultured in rabbits, and then later on it was cultured in human cells, but we'll get to that. In 1932, Russ Pfister discovered that rabies was also in vampire bats. And then 1936, Leslie Webster and Anna Clow, they stained the rabies virus and discovered its actual shape and how the cells or the virus looked. And it has a really distinctive bullet shape. And then in 1967, they began to culture the vaccine and the human diploid cells, which was progress in the right direction. As far as interesting facts on rabies, honestly, prior to this presentation, my understanding of rabies was very, very limited, and I thought it was actually completely eradicated, basically. The Office, admittedly, was a portion of why I believed that. There's a fun little clip here.
In the movies, being bitten by an animal gives you the superpowers of that animal, plus other powers. But in real life, the only power you get is the power to die. Learn the facts. Rabies kills nearly 4,000 Americans every 1,000 years. Rabies.
Kills nearly 4,000 Americans every 1,000 years. That's 4 per year. So I was under the impression that rabies was pretty much eradicated altogether. But that's just in the U.S. Worldwide, there's actually 60,000 deaths annually, and they mostly occur in Asia and Africa. There's a few different reasons for that, and we'll get to that in just a second. But symptoms of rabies can take months to develop. So those that are bitten by a dog or bitten by another animal that has rabies, by the time they realize they have it, it could be too late. And like we mentioned earlier, generally it's fatal. Dogs are the primary carrier, although there's some other animals like foxes, cats, and bats that also carry it. So one of the recent breakthroughs, and this has to do with why there's so many deaths in Africa and Asia, is called the LN34 test. This allows people to know if they have been bitten, if they have rabies, or if the animal that bit them has rabies within 2 hours of being bitten. So this helps people identify if they need treatment very, very early on. So in Africa and in Asia, the reason so many people die is because many of the hospitals are very, very far away from where they live. And then treatment can also be extremely expensive. Sometimes it's a month's salary for them to be able to pay for the treatment of rabies. The current diagnosis method is called the direct fluorescent antibody test, and it takes much, much longer than this new test called the LN34. So the reason this is so great is because these 60,000 people every year that die from rabies, now they have the opportunity to travel to a hospital, have a much faster test that doesn't require as highly trained individuals to use it to test if they have rabies, so that then they don't have to be financially hurt in order to pay for treatment if they don't have the virus to begin with. So this new development of the LN34 test is a pretty big and recent breakthrough, and it hopefully will make a big difference to that large number of deaths that occur every year.